Hearing loss in children. So, impaired hearing in children in the neonatal period is understood by the non response of the child to mother's cues and sound surrounds in the home, other people's, and lights and around. The once upon a time torch infection, toxoplasma, rubella, cytomegalo, and others viruses infection transmitting from mother to the fetus, and preterm low birth weight less than 1.5 kilo, can have autotoxicity or some sort of preterm maturation issues, bilirubin encephalopathy, and aminoglobulin toxicity, fast push of the fusimide. For you know that fusimide is be pushed by 5 to 20 minutes. Slow push, fast push has some amount of allergic otitis and thereby hearing loss. Bacterial and tubercular meningitis, mechanical ventilation, and ECMO use can have hypoxic damage. Other causes a little bit to grown-up children, 1 to 2 years and beyond, head injury, maybe syndromic Alport syndrome, neurocutaneous syndrome with otitis or otic capsule involvement. Recurrent persistent otitis made in the a little bit grown-up child is quite common. Once upon a time, still it is common. The bony dysplasia, neurodegenerative disorders, because the otic capsule, it lies in the bony structure. So there can be understood, and little less last not the least, there is genetic causes when the other brother and the parents have hearing impairment, brothers and sisters. So those cases are autosomal dominant, maybe autosomal recessive. So they have to be looked upon. This is the syndromic cases, warden bronchoectodermal dysplasia syndromic cases, and then how to treat the once it is lost, basically it may not be repairable. Send him for the hearing aid, something or the assessment of this sort of things, and the damage can or the aortic the neurovascular bundles, the sensory neural and the bony conduction part can be prevented by the appropriate use of the aminonucleic acid, dose, duration, etc., and trough level of the aminonucleic acid, seeing before it is being pushed, and the treatment of the appropriate treatment of the chronic and acute subarachnoid otitis media, and the fusimate is to be pushed in slow fashion, and treatment and prevention of the TORCH infection, bacterial meningitis is to be picked up early, prevention of bilirubin encephalopathy, and the standard care of treatment of the all infections and the the obstetric care, the preterm low birth weight can reduce the load of the the hearing impairment.